Hi, my name is Joanne Nappy. I'm doing my demonstration outline, my speech on how to test your sugar. Um, First thing first, do you know anybody with diabetes? Do you know anybody that has to test for it? Um, as of right now, I can count about 10 to 15 people that I personally know that I can write down and say what tell them or tell you guys what type they have: type 1, type 2, gestational. I can tell you guys what insulin they have, but that's not an informational speech. That would be for an informational speech, not demonstration. So what I'm doing today is I'm completely just showing you how to do the how to test your sugar, how to see where your sugar is ranging from. The plus side of taking your sugar is knowing where you fall and what foods that you can and can't use. Like some diabetics can't eat like peaches. Like if we wanted to eat fresh peaches, we can only minimize it to one or two and not um, like 8 of them. Like I shouldn't say normal people, but people that don't have diabetes. Um, did you also know diabetes is the 8th leading cause of death? Um, and most of those cases are not reported because they didn't have a history of it. They didn't have a documentation saying like this is their sugar, this is not their sugar. So in the aspect of actually taking your sugar, this is why it's important to take your sugar, is because you don't necessarily know what your sugar is going to be ranging from, or what foods or non-foods are going to do it. Most people don't think that they have diabetes until they go to the doctor, or let's just say some people eat um, like pasta. Pasta has a lot of carbs. That raises your sugar. Rices, that raises your sugar. That's going to show up on the sugar tester. Um, so it's really important to learn to test your sugar. So what I'm going to do first is I'm going to prep the area. That's step one. You got to first prep the area, which I've already done. I've already wiped table away. There's nothing on the table anymore. I cleaned it. Before I started the video, I gathered my test strips, my meter, and my lances, and the finger poker. This is really, really important. I also grabbed alcohol pads because you're going to need that. And for this demonstration only, I'm going to use hand sanitizer. Normally it's not recommended, but it's just a demonstration. So normally don't use hand sanitizer because alcohol dries out your skin, so it's not going to give accurate readings with hand sanitizer than it would with alcohol prep pads, because alcohol prep pads clean the area, hand sanitizer just cleans everything, and it dries your skin out, so it's not going to be really accurate. The second step is prep your meters. So you're going to grab your meter, grab one of the test strips. If I can get one of the test strips out. That one's like me. So you're going to grab your test strip. And you're always going to grab this. You're going to put that in your meter. And then your meter is going to turn on. Yep, it's going to show the little blood thing. Then what you're going to do is so you already put the test strip in, you're going to go wash your hands. For this demonstration, I'm going to use hand sanitizer. While you're doing this, you got to make sure your hands are really, really dry, because it's going to wipe, like the alcohol and stuff is going to wipe off, and it's going to go really, really quickly. So for the next demonstration is you're going to gather the sugar. So you're going to grab your lance, make sure there is a poker in. So you're going to put that in there. You're going to twist the top, and you're just going to pull. You're going to pull straight. just to make sure it pulls straight because the needle will bend on you. And then you're going to put the top back on. I currently have it set at 2. For beginners, you're going to do 1 because it's going to be easier and less, it's not going to hurt as much. So you're going to pull it back and then squeeze your finger. Once you squeeze your finger, you're going to get the blood circulating. So I already squeezed it. Ooh. And then you're going to squeeze your finger, try to get the blood out. And as you can see, my that finger does not like the blood. So I'm going to do a different finger. Ooh. So always the first one, you're going to wipe it away. And then you gotta make sure it's quick. And then you got the blood dripping. You're gonna get this side. And it's gonna read, so this one's gonna have to go in the garbage because it read an error. Yep, and then you just gotta wait for it to pop up. So mine's 115. It's gonna pop that up, and then you're just gonna make sure your blood, make sure you put it in like a hazmat. Anything that has your blood on it has to get thrown away. Some people put band-aids on it, some people that. So after you do that, because you already put pressure on your, you already put blood on the meter, you put pressure on your finger to stop the bleeding, and you're going to wait for the meter to read. Since the meter already read 115, that's my sugar. That's within normal range for me. That's within normal range. You're going to take your, the needle strip, put it in a biohazard thing, and then that's it. For and that's how you test your sugar. So imagine having this, knowing that you can save somebody's life, noticing their symptoms, their signs, noticing that they are shaky, or for different people that could mean high blood sugar or low blood sugar. Noticing that they're shaky, they're out of fall risk, they're hot, they're cold. That could mean anything. So you got to test your sugar. And now that you guys know how to test your sugar, and test their sugar, that will be a really good help for you guys. Thank you. Bye.